Yeah, no, Chip Green, like Representative Biles, I wouldn't say that at all. I think I've been involved in public service for a long time all around the state, and I've seen housing booms and busts come and go. And I can tell you from the time I spent out around the state, especially this summer, I've never seen housing as raised as such a critical issue from the biggest urban areas to the very smallest rural communities. And it's a combination of the price of what exists and the fact that there just isn't enough. The governor's observed that during the Great Recession, we failed to build about 150,000 units of housing, and until we dig out of, and the population has grown over that time and since then, and until we dig out of that hole, it's going to continue to be a problem that's supply and price.
Well, I want to echo Representative Kim Gatter's observation that it really is heartening that the two issues of housing and health were as carefully looked at as they were in the context of what we were doing. Thank you for that.
I think the issue, in response to your question, is not whether we need brick and mortar houses. We know we do. The question is, what role can the healthcare system play in dealing with that? And the answer is, well, not necessarily to build new houses, but to help us run those houses in the context of keeping people healthy.
Or get people to where they'll really participate in accepting that housing.
If I could just call out one other similar lining of efforts, because in my experience it's unusual. You know, we spent a lot of time working on CCO 2.0, and it's not uncommon for someone like me to roll in here and have one of you ask, well, did you know about this other big strategic plan, and did you guys talk to each other? And the answer is some version of, not really. I really want to call out the fact that over this past 9 months or so, between CCO 2.0, the state housing strategic plan, the strategic plan for early learning in the state, and the governor's children's agenda, there was a really, really strong conscious effort to look at how those four related to each other, call out the cross connections, identify things that needed to happen in this plan to enforce something else. Just a couple of small examples in our CCO 2.0 plan. We'll get an entire appendix that just calls out the linkages to children's investments as an important strategy. We've done a great job using our quality metrics to incent providers to do a really good job of screening young children for developmental delay. Well, through this process, we've learned that's wonderful, except there's a lack of services for young children with developmental delay. And so now, in the early learning strategic plan, we're able to call that out and work on investments to improve that. So I'm grateful to my colleagues for the work that they did working with us, and all of us working together to really stitch those important topics together. Ready for me to move on to CCO 2.0? I think I need